A Las Vegas woman is warning others tonight. She says she thought she was getting a cosmetic procedure, but what she ended up was a medical problem. And she shared her personal story with the I-Team's Vanessa Murphy. Vanessa investigated the issue and has more on what others should be looking out for.
Justine Hill says she worked hard at getting back in shape after she gave birth 4 years ago.
Yeah, I was so excited that I lost so much weight because I lost almost like 120 pounds.
But she felt like there was one stubborn section.
So I wanted to restore some volume back into my buttocks area. I had a lot of volume loss, so it almost looked like cellulite, but it was like very big caverns of skin, like of volume missing, so it was like it didn't have any shape. No matter how hard I worked out.
She tells the I-Team she went to a woman who she believed was an esthetician for injections in her backside.
And then it started getting very painful.
She says the pain got worse and she got an infection. When she reached out to that woman again to find more about what she injected into her body, the response: Macrolane. Look up information about the filler and you'll find a horror story from abroad after it was reportedly injected in breasts, along with concerns about whether it could interfere with cancer screenings.
If anybody is using Macrolane here, it is not with the blessing of the FDA, and it would also be really interesting on how they would get their hands on it because they're not supposed to sell it here in the United States.
Dr. Jeffrey Roth is a plastic surgeon.
The problem that we plastic surgeons have is people go to folks that aren't plastic surgeons or aren't even doctors. And we've had a couple of deaths even here in town.
Dr. Roth, who chairs a committee at the Nevada State Medical Association, also points to state law. A person shall not inject dermal or soft tissue fillers unless the person is a physician or physician's assistant, dentist, registered nurse, or podiatrist.
Okay? No one else. The other thing is where can you inject, right? So there is also a statute involved because people were getting injected at the pools on the strip, et cetera, et cetera. So it has to be in a medical facility or doctor's office. So here is where we keep the Botox.
He tells the I-Team enforcement needs to be stronger.
But here's the Botox that we have.
And he says he's treated patients who are trying to fix problems like Hill's.
I had a long talk with myself and I said, we're going to fix what I messed up. We're going to fix the karma that I caused, but everything else, I need to come up with a natural way to do this.
Hill works in the cosmetic industry. She says she's started to feel a need to look perfect. But now,
like, it's a beautiful thing to get old and older, you know, to have scars, to, you know, my C-section scars. That's my children came out of me, you know, like, it's like each stretch mark and each thing is like, it's a story.
She's concerned she may have scarring from those bad injections, but she says lesson learned.
Do your due diligence and just love yourself.
Vanessa Murphy, 8 News Now.
Now, agencies like the Nevada State Board of Pharmacy, the Medical Board, and law enforcement investigate incidents involving illegal substances, such as Macrolane, injectables given by someone not permitted to do so at a place not allowed by Nevada state law. These investigations are often complaint-based.